Good evening, Malden. I'm Gary Christenson, Mayor, and we're here at Malden Access Television, along with Ron Cochran, our Communications Director, to bring you another update regarding COVID-19. So tonight we are joined by Chris Webb, of course, our Health Director. We also have Courtney Nicholson, who is with our Board of Health. And then we also have Kevin Duffy, our Business Development Officer, to talk about the impact to what's happening out in the business community. So as always, I do just want to thank Malden Access Television. We call them 24 hours in advance and they're always there for us. So thank you to them. And Ron Cochran will help us, as always, moderate tonight's show. So without further ado, what we typically do is get some updates from our guests. And then most importantly, we really want to get to all of your questions. The one thing I can say at the outset is I participated in another Metro Mayor's call today, and I think the consensus was we're not quite sure how many more policies there are to get to where we all want to go. At some point, it's going to come down to us. And I think that's why we want to continue to keep doing these shows and to work with you to try to get us through these continued challenging times. So let's go first to Mr. Webb, our Health Director, to hear what he's seeing and hearing.
Good evening, everyone. Things are busy, a lot of things going on. The CDC just came up with a new guideline that the 15 minutes in contact with a positive individual with a masked or unmasked, masked positive case is a cumulative 15 minutes over a 24-hour period. That's brand new as of this evening. It wasn't in the correspondence today, but I caught it on the evening news. And that's important to know coming up on these holidays, that if you have a loved one who was sick, or you have a lot of loved ones who haven't been tested or don't want to be tested, as you get around them this holiday season, it might be wise to wear masks indoors as well. So give that some thought. We had 15 new cases in the last 24 hours. We have 1,713 positive cases total, and we are now at 90 deaths.
Let's take a moment there, Mr. Webb, to remember who we lost. I mean, we can't forget that, and I know you don't. And we just got to stay at it, everyone. So let's jump to Courtney Nicholson from our Board of Health, who, along with her members, just took a vote on Halloween. So I don't know if you want to touch upon that with whatever else you want to provide.
Sure. Good evening, everybody. It's good to be back. As you heard, numbers are not in our favor. And I think tonight would be a great opportunity for us to remember what we are in control of in terms of wearing our masks, washing our hands, continuing to be social distant, and then even further to think about going out only when necessary and trying to stay home a little bit more often, and knowing that a lot of people are out there that might be carrying the virus that don't realize it. So we all have a little bit more responsibility on our shoulders than we previously appreciated, and we can do our part to stop the spread. And I think as the night goes on, we'll discuss a lot of different things, but one thing is we need to call on everybody to step up and get tested and know your status, so that when things are happening and as these numbers start to rise, we can pinpoint where these exposures are happening and try to keep our population safe.
Very good. All right. And lastly, Kevin Duffy, our Business Development Officer. Kevin, please tell me we're not going back to where we once were, because I think if you saw my cooking show over the years, I have to be able to access great restaurants. So tell me, how are they doing and where are we going?
Well, the restaurants are hanging in there. I believe there's a sense that we've hit bottom and they've come off it a little bit. So it's not as bad as it once was. I think, to use the phrase, the new normal, they've kind of established this line. So they're hanging in there. We might have lost a couple over the time, but for the vast majority of our restaurants, they're here and they're doing well.
Okay. And Kevin, while I have you, do you want to talk about Restaurant Week and how the community can come together to support them?
Love to. Thank you. So the Malden Chamber of Commerce has established a restaurant week where you can go and visit all of our restaurants doing takeout, so you're socially distant and safe. but they've created a passport. So every restaurant you go to, you can get initials or a sticker, whatever the restaurant's doing. And if you can collect every restaurant on that list, you then get submitted for a raffle. Some of the places that you can go to are Hugh O'Neill's, All Seasons Table, Exchange Street Bistro, Dockside, El Patro, Mystic Station, Pizza, John Brewer's, Fresco's, and of course Faces in downtown. So there's some great dining options if you want to go out, pick up food and bring it home and be safe.
All right, very good. Okay, so now, Mr. Cochran, let's start taking some questions. That's what I think is most important when we do these shows. So how can people participate?
Absolutely. Thank you everyone for joining this evening. And as always, we are here with you on multiple mediums. We are here via the YouTube channel for Malden Access Television. We're also here on public access, and you can find MATV's government access channel on both Comcast and Verizon. That's Comcast channel 22 and Verizon channel 26. And we can hear from you in a number of ways. So what I've got going on here in my command center here is I've got Facebook up. I'm looking for your questions there. I have got some old threads from the previous week, questions related to COVID that have sort of gone unanswered. I'm looking at the YouTube feed for Malden Access Television's feed to see if anybody has questions in there. And of course, if you are traditional and you like the old way of getting in touch with us, you can always call us live in studio, and that's 781-388-9394, and we will patch you right into the panel. So
Right.
with that,
Yeah, Mr. Cochran, let me go back to the segment that we used to have there, because it's a question that I was talking with our Chief of Staff, Maria Luis, who's here today as well. So let me put our three guests in the web, courtesy of Nesta Dudley from the hit show Around the Rim, which is shown on Malden Access Television as well. And when we heard the presentation this morning at the Metro Mayor's call from Dr. Fittinger from Mass General Hospital, what he showed was a huge surge between April, May, I think just maybe coming into June a little bit. I mean, it went, up like this, then down. And then what floored me was it was really pretty straight and narrow, even through today. Now, our Chief of Staff, Marie Louise, reminded me that's all of Massachusetts. So you have to keep that in mind, when you're talking about a lot of the western cities and towns who haven't quite experienced what we have. But it prompted me to ask the question, are we at a point now where we're just managing this? Or do you believe in what we're being told on TV and in the news that we're in the middle of another surge? Because I always thought a surge would be what we saw in April and May, meaning we would go way back up and then come way back down. So let me start with Kourtney. Do you think, based on what we know now, because it's 7 months in, I think we have a better idea of what the virus is and what it can do and what it can't do. Do you see us now in a managed mode, or is there a possibility that we go back to where we once were in March, not just in terms of the surge, but also in terms of some of the policies that were in place?
So we're learning every day. I think that's the most important thing. We're listening to the numbers and we're using the hard data that we have to make decisions about what we should do going forward. And I think that that's a really smart way to do it. And it's respectful to all our people. It keeps our businesses in mind, and all of it, it treats our society as a whole. What is really important about case rates now that we didn't have in March and April is we now have a better understanding of what's happening when people get exposed. We have tools such as masks, which reduce the amount of virus people are exposed to when they get sick. I think if you look at a lot of the early cases, it's speculated that some of them had very, very severe disease because they had such high viral loads. But here, when we wear our masks and we use our tools, we're slowing that exposure rate so that it's possible that the disease is a little bit more manageable. There was just an article on NPR that talked about, I think it was a reduction in the fatality rate because doctors are better at treating the patients, people that are getting seriously sick. So we have tools to protect ourselves, protect our loved ones, and it's our job to minimize that spread so that the doctors aren't overburdened, and then they can treat those that are extremely sick. So I think I don't have a great answer to your question because the numbers are saying different things depending on what populations you're looking at. But I can say that the tools are improving and we're doing a better job, and we're using the numbers and the data to make informed decisions about what actions we should take moving forward.
Very good. All right, Chris, you agree? I mean, are we going back to where we were in April and May, or do you see this more now, us having to manage this thing?
I think it's a combination of things. Any one incident could offset the way we're managing things right now. Right now, from everything I see around town, the restaurants are doing a pretty good job. The retail businesses are doing an incredible job. Offices are doing great work. We have very few complaints, and generally when they do, it's a misunderstanding about how the guideline is supposed to work. So that's good news. I do think that we are managing and people have learned to live with it, but it's getting harder and harder to do. And when that happens, the fatigue sets in, and the minute you let yourself down, and I think people are likely to do that around the holidays, and it's hard to be saying, hey, I feel more comfortable with this mask on if you don't mind, in a room full with your family. You know, they're going to say, well, you don't trust us. But the reality is it might be the smart thing to do for your older relatives or relatives with immune compromise. You really got to stay focused on it. It may be managed, but it's still very dangerous.
Okay.
And, I could chime in too one more time. And something that Chris just said that reminded me is we keep, every time something happens or we get a notification that we're still in the red, we immediately go back to Chris and say, is there any one event that could be an explanation for why we're seeing a spike? And the answer is no. So we don't have hard data that says that, you know, the restaurants are doing something wrong or that having the parks open are an issue. And so that's where we kind of want to encourage everybody that go get tested regularly, even if you don't have symptoms, especially if you do have symptoms, even if you think it's just allergies. There's a lot of different testing sites. We can make sure that they're posted so that you have access to them, but just to know your status so that you know what you can and cannot be doing. And then importantly too, if you do come up positive, then we need to backtrack. Where have you been since you started showing symptoms? Are you proud of everything that you've been doing? And or would you be nervous because you had been, you know, taking your casual trip to Target or something? So be meaningful in the actions that you're taking. So I think, yes, manage state now, but we're having a hard time tracking down where these events are happening that are causing little bursts of outbreaks. So that's important to keep in mind as well.
All right. And then conversely, Kevin, I don't know if the restaurant industry gets a second chance, right? I mean, if we ever went back to where we were in March, April, it's lights out, don't you think?
Absolutely, since most of the resources that are out there have been drained, whether it's the federal money or whatever the state's been able to offer of the city. So if there was another big shutdown or something that really scared people from even, you know, ordering from restaurants, it would be fatal for a vast majority.
Yeah, and I appreciate your help. I know you worked with our chief to organize a meeting with the Lieutenant Governor's office where we were able to advocate that going forward, they really need to help out, you know, the businesses, the restaurants, because I think the biggest thing that you told me was just the difficulty they're having paying their monthly lease. And then you really can't blame that on the landlord because the landlord has to pay the mortgage. So if they can help, that would be the spot, right?
Absolutely. And it quite literally, the buck does get passed up. The restaurants make the money, they go to the landlord, landlords give the city, the state, the feds. So when it stops happening on the lower level, it's felt all the way up. The big thing for us right now is just there's far fewer customers than we've had in our heyday. You don't have people on the MBTA coming through Malden like they have. You don't have the large office buildings filled to the capacity that they used to have. And you're not having a place like Bodeborg that used to generate 200,000 people through the square. Those are all customers, you know, so when they're not in the area, that they're not shopping, they're not buying, and that's hurting the businesses. I think when I said that we're no longer at the bottom, you can start to feel that. When you drive into work, you see traffic. You're starting to notice more cars on the road. On one hand, it is traffic. On the other hand, it is customers. So we're trying to walk that line where everyone still needs to be cautious, but we're trying to support the businesses.
All right, very good. All right, Mr. Cochran, let's open it up.
Okay, we are going to probably stay right there with Mr. Duffy, because one of the questions that did come in was in regards to restaurant safety, and I'm fairly certain this is on the heels of two recent incidents reported in Malden restaurants, and that is when I walk into a restaurant, what are the signs that the restaurant is taking safety precautions seriously?
Okay, Mr. Duffy.
Thank you. Yeah, I'll start with that, but I know Mr. Webb can certainly add into this. But when I go out to go to a place, the first thing I'm looking for as soon as I hit the door is clear signage. Are they telling people that you need to have a mask right there? And then just looking around the room, is everybody wearing a mask that's up from a table? If I don't see everyone wearing a mask, if there's some people walking around and staff isn't hustling over to tell them to put a mask on, I'm going to turn around and walk out. But that being said, when you go in with a party of people, is someone from your group being asked to turn over their information, contact tracing? If something happens in that restaurant that night, they need to be able to contact everybody that was there. So if I'm not being asked, then I might not be informed if something happens. So if I'm not being asked, I'm going to turn around and walk out. And then a lot of it is you see the QR codes on tables where you can basically call up the menu on your phone. I don't want to see anybody bring me a menu that other people have been handling. I either want a paper menu that I can take with me or throw out, or something that I can look at on my phone. If I don't see any of those things, I worry.
Chris, we might have to add him to the Board of Health.
I think so. I've got a spot for an inspector. I got a little overtime money. I think we can work something out.
All right, take it.
No, he hit all of the big points right on the head. And of course, general sanitation, right? There's a lot of things that the restaurant owners have new responsibility for. All the line management and table distances and making sure they don't get shifted and making sure that their customers are at least being safe amongst themselves. So it's a lot, and there's a lot of it's new to them. So, but the one thing you never want to let them up on is sanitation. So if you didn't see them clean the table you're about to sit at, ask them to wipe it down for you. That shouldn't be a big deal for anybody to do that for you. And if you just think that someone, a staff person or another guest isn't quite up to code, ask the waitress, if that's really what should be going on, and just be safe. When in doubt, put your mask on.
All right, Kourtney, between you and Chris, tell me, where did those two, or maybe Chris, you have the details. So where did it go wrong for those two restaurants, or did it? Was it innocent on their end, or?
It was a gap. One was a gap in management, and the other was someone playing loose a customer playing loose and free with the rules.
Okay.
And not making it easy for the staff to know what they were up to.
Okay.
Yeah.
All right. Kourtney?
I don't have much to add, but I do think, just want to remind everyone that if you aren't comfortable going to the restaurant, order out, right? We want to support our businesses in this tough time, and that's a great way to do it. Yep,
good point. All right, Ron, back to you. Who's next?
Well, that's a good follow-up, because that is some of the feedback where, when we did post that the restaurant had, someone in the restaurant patron had tested positive, it was an overwhelming amount of support for Malden's restaurants. In other words, the thought was keep at it, keep safe. And I think it's important to note, and I like the way Kevin went at it, which is to say that taking personal responsibility and what your own comfort level is, as opposed to sort of casting, a light on what the state of the restaurants are. Because I think for the most part, Mr. Webb would agree, these restaurants have been doing a great job. At least that's the feedback I keep hearing week to week. But on that, one question we did have is, what is it that the health department or the city does to make sure that restaurants are staying on target and doing what they're supposed to be doing and complying with the law?
All right, Mr. Webb.
Well, we always have inspectors out. We have inspectors out, not tonight, but they'll be out over the weekend, checking in on the bigger establishments to make sure that the crowd management is being done well, the registration at the door is consistent, that staff in the larger places are doing all the things that they need to do. That's very important. We don't, you don't want a staff person getting sick either. I mean, just be, that's how the spread keeps going. You get one staff person ill, they could keep reporting to work asymptomatic, and they're infecting entire rooms. We don't want that. So again, the restaurants have been doing a great job. The people, the wait staff in the restaurants do the yeoman's amount of work and are watching out for one another and their customers. I think
And
they've
Chris,
learned a lot.
And those visits that you make, they're unannounced?
They are. All of our visits are unannounced. And then what we do is periodically we'll send out more signage so that they can refresh their signage. We send updates from with the governor's orders so that to any business that's affected. So we got everybody on an email chain, and we really spend a lot of time making sure that they get the things they need. If they don't have it, they ask.
All right, Kourtney, do you want to add?
Just to add that even like last night while Chris was presenting to City Council, he had a team out doing inspections and just trying to keep everything safe for everybody. So, you know, we have some of the best inspectors that they work tirelessly. I think the whole department's working tirelessly to try to keep on top of everything, keep everybody safe.
Okay, and Kevin, I know from what you said previously, it wouldn't be a surprise that you also go around and see what's happening within the restaurant industry, correct?
Absolutely. I hit, it's my job. I hit a lot of businesses all the time.
Yeah.
And so in addition to just talking to them and seeing what they need, I'm keeping an eye on things as well. And I relay it to Chris if I see anything that's not right.
Right. One other bit of advice, maybe, people could always go once, like I do, buy extra, freeze it, and forget about it until your sister and your chief of staff comes over a year later and remind you that why would you have left that over a year? So let's go to the next question. Mr. Cochran.
Not quite sure who you were talking about there, but I think we'll move on. That question is in regards to some housing instability that we've experienced here in Malden. So we've had quite a few questions about the eviction moratorium being up this past weekend and wondering what protections that our residents can look for in light of that end of the moratorium.
Yep, I could take that question. We have been meeting weekly every Thursday morning on this since the pandemic began. And as many of you know, we did just complete our first rental assistance, both for residents and businesses. And we're now in the midst of working on a eviction prevention program. And we're using the new round of money that we got from the federal government, thanks to Senators Warren, Markey, Congresswoman Clark, and also working in conjunction with the state. So we're getting ready to announce the particulars of that program, and we'll have the phone number and the email on how to participate. But in the meantime, we have issued, as of today, a list of resources if anybody comes into anything since the moratorium ended last weekend. There's a bunch of resources with contact information that people can utilize. Now, we don't anticipate that happening because I believe there still is a federal rule in place that is going to prevent any rush of evictions happening between now and the end of the calendar year. But again, we're meeting every Thursday morning on this, and we believe this next program, it won't be so much in the form of the first program, which was straight up assistance to landlords to help cover rents that had not been paid. But this will be more, I think, geared toward the court process. So we're going to be looking to partner with some of our community providers to be in housing court, to be in district court, to help with people being evicted. So stay tuned. We're just finalizing the program, and we'll announce it very shortly. But in the meantime, check today. It will be in the paper on Friday in the Malden Advocate, all of the resources that people can utilize in between.
Mr. Mayor, we actually do have our website, I believe, is available now, and ahead of that press release, and that would be just to go to cityofmalden.org/eviction, cityofmalden.org/eviction, and those resources that you point out are there and available. We are still, again, checking all of our different mediums for questions. And so far, we have not had a caller to the studio, which is unusual. So we're still waiting on that line. But again, we are checking Facebook and we are checking YouTube in our channel here, and questions are coming in. So the question that actually, this has been sort of a recurring question since we first went in the red. So I think some residents, as soon as we went in the red, thought that that immediate designation, sort of rolled things back. And there were some questions about whether schools needed to now be remote, whether or not restaurants needed to be rolled back, et cetera. And the beat of the drum then was that we were just at the beginning of it. And this question is, are we coming up on another threshold that is going to require us to make any changes because of being in the red too long? What's the designation? And, are there changes coming up? Is there some hard rule that comes up at some point?
Okay, Mr. Webb.
There's no hard rule, but if there is, there's one, and that is after 3 weeks in the red, that you will start looking at rolling back. It's not the first thing you'd want to do, mainly because our increases are so incremental, but keeping us in red, that the variance, we don't know what tomorrow number is going to bring, but the variance has been so small that it's almost, of course, people are getting infected, but there's almost nothing else we can do. So the board will have to look at those incremental increases and the current status and the reality of people going in and the holidays coming up. There's a lot of intangibles that have to be considered. If it were, there is no rollback automatically. The board can actually decide too whether if they want their own rollback, a modified rollback. And I think that would be what I recommend to the board, that we modify it and then have a time frame that if the information changes, we either go forward or we roll back even further and have predetermined what that next step would be. But that would be entirely up to the board.
Okay, so Mr. Duffy, all eyes on Bodeborg, right? Because they just reopened?
They had just gotten back up and running, and I do know a lot of people were thinking, well, this is a good time to go to Bodeborg, because normally it's very crowded. Numbers are obviously depressed a bit, but you can go into Bodeborg in teams of 3 to 5. So you can handpick the people you go in there with. It might be close family, the same people you would go into a restaurant and sit at the same table with, and you can go through and do some of the activities over there. The real concern is when you're passing people in the hallway and everything, but that's when you're having your mask on always. So I think Bodeborg is a safe place to go, as long as everyone's kind of following their own personal safety protocols. But I think if there is a rollback, we'll have to look at maybe some of the quests that are more strenuous, that do cause heavier breathing, and see if there's something that needs to be done about it. I know Chris and Kourtney will, kind of weigh everything in hand, but hopefully we can come up with something that allows Bodeborg to continue on in some fashion.
All right, and Kourtney, there's no hard, fast rule, right? That's a sense, I believe you and Mr. Webb have really been trying to find the right balance.
You got it. The 3-week rule kind of, or the 3-week guideline tells us what the trends are in the numbers, because one week to week, it's hard to kind of know. It's always a snapshot. And with this virus specifically, it takes time. It takes a lot of time to see what's happening in our population. So we need to give the virus, well, we don't want to give the virus time, but it takes time for people to come up positive when you test. So that makes everything challenging in making decisions. But what we will be looking for are numbers and evidence of different activities presenting greater risk for or causing greater spread, and then use that to justify kind of decisions about what would we roll back if we had to come to that.
Okay, very good. All right, Ron, where do you want to go now?
Well, I just wanted to make a note. We've been talking a lot about issues that have been covered through a variety of social media posts, and it seems as though what happens is we'll put a post out there that I guess we would call somewhat controversial. Some would call it informative, some would call it controversial. But let's take, for instance, when we publicized the restaurant closure, or the restaurant announcing that it had a patron test positive. And one of the things that I observed of note is we've got so many incredibly positive residents in the city of Malden that really want to rally together, applauding the restaurants, encouraging people to do the right thing. But then, of course, we did have quite a few people that want to kind of bash, other folks. And I think it's important to point out, I think what will really help us as a community is if we get more of the voices on there that are sort of moving in the right direction, helpful comments. I think this is the only way we're going to beat this thing is together. So it's just something that I've noticed on social media because it's the job that I do every day, that we do have a lot of these folks that are, vocal in the right way. We want to keep on encouraging those that are speaking to that. With that said, we do have a question. Actually, Mr. Duffy covered, we did have a voter board question, which is great. So that was good foresight in that. The question that we had a couple of weeks ago and never got a chance to get to it was gyms. We've got obviously we just opened up Soul City Yoga across the street from the new City Hall. We have TPS, we have Crunch, or that might be Medford, but we have several gyms in and around the city. What's the status of gyms right now?
Okay, Mr. Webb?
Gyms are open. They have a diminished, it's hard to describe. They've got to go down to 50% of their occupancy. But what most of them have done is gone less than that, mainly because they had to reduce some of the aerobic equipment and add some other stuff so that people could do a circuit training that isn't going to blow everybody else out of the room. So they've all come up with their own unique setups within their own facilities. We've had 0 complaints, which was an area I thought we would have a lot of complaints from, but I don't have any knowledge of any complaints at our gyms. We did get a few from the Medford gym, and I referred those over to Medford, but no, it seems to be going well. And it's really an infection, high infection area. You're sharing a lot of equipment. Cleaning it isn't always as easy as it looks. And you really have to take a lot of personal responsibility and trust the people you're using the gym with. If you don't go.
All right, Kourtney?
Gyms are one of those places that make me nervous because you're very aerobically active. So you're producing a lot of potential aerosols if you are a spreader. So it becomes one of those places that make me a little bit nervous. But that being said, we have guidelines in place so that people can utilize the gym safely and effectively. So I mean, we again don't have numbers that say the gyms are a problem. So I have to applaud everybody that's going and doing things safely to the best of their ability.
Okay, Kev, you want to add anything or go back?
Yeah, thank you for the opportunity. Actually, I think it's interesting because what you've seen with the gyms is the casual user who might be a little lackadaisical with, their safety protocol. I think they've dropped off. They haven't been in there. So the people that are going to the gym are the serious people, the hardcore people, and they're taking the precautions very serious because they don't want to mess up their routine. They're in the middle of training and they're just trying to accomplish something. So they're being very serious about wiping down everything before and after they use it, wearing the mask. So I got to give a tip of the hat to the people that are still, going into this and doing it the right way.
All right, very good. All right, what do we have next, Mr. Cochran?
Yeah, sure. So I think something that we could probably never talk enough about because it's come up probably every day since we made announcements, and that is Halloween. Where do we stand? Obviously, was some guidance issued last week. And the questions continue to come in. And as I was talking with our chief of staff, Maria Louise, we said, we were sort of debating on how many times we should post this. And I think the consensus was people are so interested, we should be posting frequently because the questions just keep coming in. What should we do? Are we planning on canceling? Could we potentially pull the rug out from, from under our residents at the last minute? So if you could expand upon what our Halloween plans are.
Well, let me start with Kourtney, because one question I've had throughout this whole discussion, Ms. Nickerson, is whether or not we actually have any jurisdiction over this to begin with. Do we?
So I know that, I don't know if we have jurisdiction, but we have guidelines. So
Right.
This is
But
an outdoor act.
you couldn't say to the community, you're banned from trick-or-treating, right?
Well, we could say it. I don't know if it's enforceable.
Yeah, right. Yeah, I
That's
guess.
the question.
Right. Yeah, that's
So Halloween is an outdoor activity. Trick-or-treating is an outdoor activity. So we feel that it is possible to do this safely. it is not guaranteed to do this safely. There is always going to be a risk in participating in activities like this. So we do recommend that if people are going out, to wear their masks, wear their protective masks in addition to any costumes, to make sure that they're observing social distancing. They are not spending more than 15 minutes in close contact with other people. Keep that space. If they're participating in trick-or-treating, take your candy and go. Do not linger. Do not use a shared bowl to give out your treats. And the full list of guidelines is on the web, and it's probably said a little bit more articulately than I just rattled off. But we didn't want to take Halloween away because, you know, we need things to look forward to, and people need the holidays to be excited about. And we're going to have a much more challenging time coming up when you think about things like Thanksgiving, where families get together in a closed space, and we're much more concerned about the potential for spread in those closed group, small environment scenarios. So Halloween is one that could be done reasonably safely, but again, if your gut says it's not a good year to participate, don't participate. Sit this one out, it's okay.
And Courtney, what was the vote of the board on those guidelines? Unanimous?
I think we were unanimous because we were unanimous.
Okay, and before we go to Chris, Ron, how can people find those guidelines? What's the URL?
So they're right, actually, it's just right on the front page of our city website, cityofmalden.org, and it's under the alerts section.
Okay, Mr. Webb?
I think that Dr. Nickerson nailed it. It's an outdoor activity. It's, you know, is it safe? I would say no. If I will not be giving out candy this year. If that helps anybody make up their mind, I don't know. But some people this is a true holiday for. That's not what it is for me. But if you're one of those people who has to go to Salem and enjoy it, I totally get it. Be super safe. Enjoy yourself, step away, get some air, do what you've got to do. But if you don't have to, don't do it. Come up with something for the kids to do at home. I always, you know, the first thing that came to my mind was my kids always loved the Easter egg hunt. Why not just put candy all around the yard in the most ridiculous places and make them go out there and get it and scare them while they're doing it? It should be a lot of fun. But stuff like that is probably better leading into the season that we're going to. Multiple contacts going into cold weather is not good for any family. Okay, and Kevin, what is the chamber and the businesses doing? I presume they're taking the year off, right?
Yes, that's going to be the plan. I think everyone just wants to err on the side of caution. So everybody wants us to be over with, so we're going to do what has to be done.
Yeah, so you think a lot of them are not going to be doing what they traditionally did, right, in the square?
Correct.
Okay, okay. All right, Mr. Cochran?
Yeah, we've gotten a lot of, I'm going to combine a couple of questions we've gotten, which are looking for availability of both vaccine, and obviously they must be talking about flu vaccine at this point, although maybe you could touch on any news that's come out about the COVID vaccine. So availability and location of flu vaccine, maybe touch on COVID vaccine, but then also testing. Where around Malden can they find testing?
All right, we're going to go to Mr. Webb, followed by Ms. Nickerson, and then we'll take our next question. Mr. Webb?
Okay, I'll start with flu vaccine. Flu vaccine, we had a flu clinic today at the Salemwood School in conjunction with Walgreens. They had a great day. They did 460 people, and they only stopped because it got dark, and they would have kept going otherwise. So our office just received our vaccine yesterday. We're going to be looking at different sites. Of course, we have to look at taking care of our seniors first, and then we'll open up a public free clinic and vaccinate as many people as we can with the vaccine supply that we have. So be ever cognizant that those dates are coming out any day now. The COVID vaccines, there's 3 on hold right now. It depends on who you listen to as to what's going to happen. I do think that, and I've said this before now, I guess I'm going to stay with it, is I think by January, they'll have an approved drug that people can have faith in, but there's going to be time to, manufacture the drug, distribute it, manufacturing it is going to take any time at all. Distributing it is going to take all of the time, because 3 of the 5 are required to be kept very, very cold, and they have to be shipped in dry ice or refrigerated vehicles that can be relied on to maintain the temperature, because as soon as you lose the temperature, you lose the vaccine. So it's going to be a challenge for that. And I think what we're seeing as far as the vaccination for COVID is the federal government is working very tightly with large chain stores, the Walgreens, the CVS's of the world, to provide the initial outlay to the public. And then people, the agencies that do big clinics, health departments, will then get larger amounts. And really what they're going to be looking for at Walgreens and Rite Aids and CVS's is that those people who are essential, that have to be at work, healthcare workers and all that, they may be able to get it at the hospital, but they may not. They may want to get it while they're out on vacation or whatever. Police officers, firefighters, EMS, they're all going to be the ones we focus on first, as well as our senior population. Then we'll move down and so on and so forth. The second part of the question was what? I'm sorry.
COVID vaccine. What's the latest news?
Well, the latest news there is, like I say, 3 out are on hold. I do think that 2 will be coming off soon. 1 had a very severe reaction that they're very concerned about. They don't really speak too much about what the reaction was, but there's the other 2 are moving right along. So coming up through the middle of phase 3, I think. And, you know, I really don't care how many people companies manufacture it, as long as they're willing to share the science so that it can be studied and there can be an agreed, you know, our medical society can take a look at it and agree that it's safe and give the people, you know, all the confidence they need. You know, look, someone my age will take a shot of anything if someone says it's going to make me better. But would I make want my children to do it? I don't know. Would I want my mother to do it? Probably not. So confidence and good, you know, ask questions all the time through this process.
Dr. Nickerson, so I think Mr. Webb touched upon the flu vaccine pretty well. What are you thinking about COVID vaccine? Where are we and where we're going?
Well, first we got to ask you, did you get your flu shot?
Do you want to see? Do you want to see what happened?
I think we need to see the video. Right, so just we'll encourage everybody to go get your flu shot. 100%, absolutely. It's that time of year. Get it now. It takes a couple of weeks to be effective, so you want to get it before the flu really kicks in for the season. So Chris mentioned that there were 3 vaccines that looked promising. I've got the World Health Organization draft landscape of vaccines up right now. There's 44 candidate vaccines in clinical evaluation. That's globally. So that's really, really exciting because they span everything from inactivated viruses to viral vector-based vaccines, RNA-based, and protein subunits. So that might not mean a lot to everybody, but for just know that they're trying a lot of different things to get to an answer for everybody. So this is great news. And it's taking time, which is unfortunate because we'd like this pandemic to be over, but good because this virus, we don't know what's happening. We don't know what the long-term effects of the virus are going to be, and we don't know what the long-term effects of this vaccine could be. So we need to give them time to test it in people. Those brave volunteers, thank you everybody who's out there and volunteering. Make sure that there aren't adverse effects and that it is well tolerated. I did hear some exciting news that I think one of the UK vaccine groups is actually going to do a challenge study. So what that means is they'll give people the vaccine and then they'll expose them to the virus to see how effective the vaccine is. So that's exciting because that could accelerate the availability of the vaccine as well. So a lot of good things happening in the vaccine landscape, and hopefully we'll have some good news soon.
Okay. I think Mr. Cochran's going to put up the proof.
Well, fortunately for you, Mr. Mayor, I am not on the same computer that has the evidence, but I will continue to work hard before the end of the show to see what the results are of your flu vaccination to the best of my ability.
Dr. Nickerson really made an impression upon our chief of staff because she has sent it to your phone, I believe. So.
Okay. Yeah. All right. I'm going to get working on that.
All right. Let me jump over while you're looking at that to go to Mr. Duffy and see what he's hearing and seeing regarding the flu shot. Did you get yours, Mr. Duffy?
Of course I did. And I got it several weeks ago as Dr. Nickerson recommended, so that it was going to be fully in effect when the flu actually comes around. But I did hear something, and maybe I can throw this out to the panel, that this year it does seem like the number of flu cases are lower than it has been in the past, and they're attributing that to people wearing masks more often to prevent COVID. So it seems like an unintended effect is that we're learning it's much safer to wear a mask more often. That seems
What do you
right to you
think,
guys?
Mr. Webb?
I'd agree with that. It's a good practice to get into, especially this time of year, even if it isn't COVID, influenza, and all the other viruses that are easily transmitted this time of year through respiration are important to protect yourself from.
You think so too, Dr. Nickerson?
I do, in fact. I also learned that parts of the globe, they actually wear masks once they show signs of a sniffle or something, just to protect those around them from getting from the spread of disease. So really, really effective in ways that we hadn't originally intended.
So do you think this is something that could stay with us?
I could see people wearing masks as sort of a common courtesy to prevent spread if they started to feel ill. Absolutely.
Okay. All right, good question, Mr. Duffy. Let's see, where do we want to go next?
Well, since you asked for it, well, let's go ahead and share proof that Mr. Mayor did receive his flu vaccine. So let's just take a quick look at that really quick. And we do have audio in.
Oh, God, you're bringing me back. Let me turn my head. Please.
You're very, very brave. Thank you.
There you have it. All right, let's see. What do we have next, Mr. Courtney?
Yeah, actually, hang on one second. We're we just want to remind folks, we're close to the top of the hour here, and we still haven't had any of our callers that normally call in. We do, again, want to remind folks that you can reach us here in studio at Malden Access Television, and the phone number is 781-388-9394. And you have just a few minutes to get in time before we wrap up to get that in-studio call. And once again, we're looking on Facebook, we're looking on Twitter, and we're looking on YouTube for all your questions.
Ron, why don't we at this point maybe stop and let people know that we are continuing with the mask giveaway. So our next giveaway will be, I believe it's tomorrow, from 3 to 5 in front of City Hall, 215 Pleasant Street. And you can either pull up and we'll bring it to you, or if you're walking by, we'll hand it to you. So again, that's from 3 to 5 p.m. tomorrow, Thursday, October 22nd.
We actually hope too, when you do walk up and grab a mask, if you want to give yourself a selfie and share with the hashtag #MaskUpMalden. Mask Up Malden is what we're sharing our hashtag on.
Yeah, and we also have, as always, our community partners, Malden Reads has joined in with us, where we're going to give books away as well. And then if anybody can't get here tomorrow, we are also working in conjunction with our city councils. They can call any one of their local ward councilors who will also assist in getting anyone that needs a mask.
Okay, our next question is about, how have we been getting into the red? Because I think, we've explained this, I think, poor Chris, I think we've had him explain this, each and every show for the last 4 shows in a row. But I think it bears review because it's a confusing thing, right? You see the red color and you just think, man, oh man, things must be terrible. Maybe you could explain what, light duty red, heavy red, how does it work?
And Chris, why don't you also give some scale, some perspective that, when you hear what we're going through versus what another city around us might be going through, just to give some perspective.
Sure. But first, I'd like to let people know that 35% of all positive cases are from interfamily mix. 50% is community spread. So that's when you're out doing, dining out or at the soccer field or in the supermarket or walking down the sidewalk. So that's the main contributor. But when it comes to red, we are the number eight cases per 100,000 will get you into the red. We are at 10.50, and tomorrow we'll find out what our new number is. I don't anticipate it coming out of the red. I do think it will move us a little towards the middle of red. And right now I like to call it red light because we do show good signs on some days, and our testing is strong. It can be a lot stronger. We've had 38,000 tests in the city. We have 65,000 people that live here. So we have a lot of work to do there. And I would, ask people to get out and get tested. Go to CVS, either on Ferry Street or on Eastern Avenue. Go to the Minute Clinic. They'll take good care of you. The site in Everett is excellent. Everybody that's been there has had good things to say. The Saugus Square 1 site is excellent as well. You're in and out. Don't go at the opening. Let other people stand in line, but give it an hour and then go over there. Here it's very good. But there's no real way to do it. What we're going to look at when we're making our decisions going forward is how far into red are we going, but more importantly, what's the positivity rate of all the testing. If people are being tested and the positivity rate is too high to be safe in a communal setting, then the board's going to have to make some decisions on which one of those communal settings has to cease. And it hopefully our positivity rate, it creeps up because, if more people get tested, it will probably creep up because we'll have a balance of negatives. So, and keep in mind, the more people get tested, the quicker we can figure out really what it is that's causing it. Right now it's a conglomerate of things because it's so spread out and there isn't enough testing to confirm really anything. So I would ask people that if you really want to know the answer to things, get out and get tested and it will tell us.
All right, and Dr. Nickerson, 10.5 per 100,000. There are some cities, I feel terrible for them. They're at 20.25 per 100,000. Is that right?
Yep, their numbers are they're all over the place for the state. But as Chris was saying, we don't have enough data right now. So please go get tested. And people should go get tested routinely. I don't know, we don't have a recommendation on how frequently if you don't have symptoms. But if you do have symptoms, go get tested, make sure that it's not COVID, or if it is, then you know how to handle it. And that will help us get that information that we need to sort of bridge the gap and understand where our major risk points are in our community.
Dr. Nickerson, too, why don't we clarify for people who think once you get tested, that's it?
Oh, testing is a snapshot. So it captures a moment in time when you've been tested. So you could test negative, but still have the virus. And that's tricky because if you were only exposed a couple of days before you got tested, it means that your test could come up negative. So that's why we kind of recommend, well, we don't formally recommend, but I believe that people should go frequently, every couple of weeks. And then if you do have symptoms, go get tested as well, because if you have symptoms, it's possible that you could be shedding virus because that's your body responding to it. So you should know your status.
And back to Mr. Webb, what about some at the highest levels of office in the country have said, once you do have COVID, you're then immune? Is that true?
I don't believe that to be true.
And the data or the science hasn't shown that, has it conclusively?
That's why I don't believe it to be true. The science is not there yet. Again, it comes down to not enough testing on that particular point. There aren't enough people who have had that test to say that with certainty that it is there. There is some reason to believe from what they've seen, there is some. And I tell people some to me is not firm enough. It's not like it's a lot like influenza. You get the flu and it doesn't make you immune, okay? It may make you immune to that strain, but we already know COVID has at least 2 or 3 strains already. So it may become a seasonal thing, and let's hope that it doesn't. That's why we need more testing as well. So we can check the DNA of the test results so that we can see how many strains are within an area. And they may end up having to, people need to know this, that they may end up having to have different types for each strain. Or like they do with flu, they may get good enough at it where they can put all the strains into one vaccination, whether it be 1 or 2 doses to complete a cycle. And there's reason to believe that COVID will be a 2-shot cycle. So, I forgot my train of thought. I get so excited about thinking that the vaccine's coming. But yeah, I just
whether or not you're immune once you
yeah,
have
it's
COVID.
just it's there's not enough there. If there antigen, everybody's talking about antigens and antibodies, and it's all lost because there isn't enough testing. There really
All right.
isn't.
All right, we're at about 7:55, so we can get in one or two more questions. Ron, what do you have in the can?
So I think actually that clears up the questions for this evening. And I did want to leave obviously some time at the end, for closing remarks. But actually, before I do that, I'd be remiss if I didn't use at least a little portion of this meeting that's about COVID, but to talk about an unrelated topic, and that is about voting. I was with our city clerk, Greg Lucy, this morning, and Crystal Lamb, our liaison to the Chinese community for the city clerk's office in voting. We were at one of the at 557 Pleasant Street helping some residents, and just a reminder at how incredibly hard our clerk's office is working to enable the citizens of Malden, the residents of Malden, to get out there and vote. Right now, we're in the midst of early voting. Early voting is taking place at the Senior Center, located at 7 Washington Street, through October 30th. The specific hours are on our website at cityofmalden.org/vote. And then, of course, we have our options for mail-in ballots, which can be obtained by contacting the city clerk's office. And then finally, of course, election day itself, Tuesday, November 3rd. So all of those tremendous opportunities, and by all accounts, and I think you would agree, Mr. Mayor, this might be one of the highest turnouts that we've had historically. So COVID, in a related way, may have just helped our system of electoral system. So again, we did want to mention that.
Ron, can you talk about the drop-off boxes as well?
So there are two drop boxes that have been installed recently. One is outside of City Hall at 215 Pleasant Street, and the other is outside of the police station at 800 Eastern Avenue. And these drop boxes are secure. They are monitored. They are picked up daily. So if you have a mail-in vote that you don't necessarily think that U.S. Postal Service is the way to go for something so valuable, you can manually drop those off. And actually, I believe City Hall now has a reserved parking spot for cars that just pull up, so that you don't have to double park. You can pull right in the spot, drop in your ballot into that ballot box, and again, 800 Eastern Ave at the police station. And if you have any questions, you can contact our city clerk's office at 781-397-7116.
All right, let's close it up with our panelists, first by thanking them. And then when you do give your final remarks, can you just provide your contact information in case someone has a question that they didn't get to ask or they think of it after the show? So, Mr. Webb?
I just want to thank everybody for watching and doing such great work that they've been doing. But I want to remind them, as I always do, wear your mask, stay socially distant whenever possible. Sanitize surfaces, that's not said often enough these days, but it's very, very important as we go indoors. So sanitizing touch points is super important at this point. And I want to thank Walgreens. I think they did a great job today. They're a great community partner helping us out with our shortage on vaccine. They had a great turnout of 460 people. And like I said, they only stopped because it got dark. So we'll be working with them more, and I'm looking forward to it. They were a lot of fun. People seem to have moved through the line. I'm sure there were a few spots where it got hitched in the warm weather, but we're okay. And I want to remind everybody, if it matters, go out and vote. Definitely take your part of democracy.
All right, very good. Thank you, Mr. Webb. And how do they get a hold of you?
My email is cwebb, W-E-B-B, @cityofmalden.org, and the office phone number is 781-397-7049.
All right, very good. Thank you. Dr. Nickerson.
Hi, everybody. Thank you again for having me be a part of our show tonight. It's great to connect with all of you. It's great to be able to communicate kind of what we know about what's going on. Please reach out to us through Chris, through the board, and let us know how you're doing. Let us know what's on your mind so that, you know, we know what issues are affecting you as well as we navigate this really challenging time. And I was really, really pleased to hear how positive our community is via social media interactions and with how seriously everybody is taking the actions that they can control by, you know, washing your hands, wearing your mask, practicing social distancing. Go get your flu shot. Thank you so much. Have a good night.
Very good. And finally, Kevin Duffy.
Thank you, sir. Kevin Duffy. So it's K Duffy, DUFFY at cityofmalden.org. I can also be reached at 781-397-7000. And then my direct extension is 2009. I just want to close. I know we're up against the time, just to tell people, support your favorites. Our restaurants have been incredibly resilient, but they need your help. If you're comfortable going and dining in or dining out or doing curbside pickup, please do that. At the very least, order up some gift certificates so you can go and enjoy later on next year. But support your restaurants. They need your help.
All right, very good. So thank you to our panelists. Thank you, Ron Cochran, our communications director. And of course, thank you to Malden Access Television and saving the best for last. Thank you to you for watching and continuing to do your part. The one thing that I've seen after several months is that we have tried every policy imaginable. And now it's up to us to find our way through, hopefully a time we'll never see again. So again, hang in there, everyone. Tomorrow, City Hall, 215 Pleasant Street, from the hours of 3 to 5 p.m. We'll be out front giving away washable masks, and hang in there, Malden.